I'm Callie Zanandri. On today's COVID-19 update, we have Dr. Harrington joining us. Good morning, Dr. Harrington.
Hello, Callie.
So vaccines are being rolled out. Give us the latest in Routt County.
Yes, it's exciting and frustrating at the same time. It's exciting because this does provide, kind of that light at the end of the tunnel. It's exciting. A lot of people are anxious and accepting of the vaccine, but it's frustrating at the same time because our supply is so limited. The CDC and the state have promulgated guidelines on who we're supposed to prioritize for vaccinations. That first started with frontline healthcare workers and first responders, for example, and then it started to include other what's called critical occupations, and they added in that we should start vaccinating those who are 70 and older. And in fact, that age criteria has become a top priority. And based in part on the understanding, of course, is that this disease is especially fatal, if you will, as well as causing complications in our older population. That's what the data bears out. So just from a disease perspective, if you want to reduce deaths, then that makes sense to start there. The state has emphasized that that is a priority for us. And to that degree, we're not allowed to move on to the lower, not lower, but just the next levels of immunizations until we have gone through what they've told us we need to reach is a 70% mark. They expect us to have vaccinated 70% of those who are 70 and older in our county before we can move on to the next levels. So to do a little math, census information tells us the last time that we have perhaps 2,600 individuals in Routt County who are age 70 or older. I would estimate that that number is actually higher. Meanwhile, we're only getting a few hundred vaccines a week. So it kind of marches out that it could take us weeks, even close to a couple months to get through all that. I think we'll probably do better than that and probably be through our 70 and olders by sometime here in February. But that is the way the math works out. We have many other groups that we're focused on getting immunized as soon as we can. One of those groups has been teachers. While the 70 and older issue is one based on the disease and focusing on where the disease has the biggest impact in terms of health, we all understand that disease is impacting our society in so many other ways, and those also do involve social determinants of health. One of the areas is keeping kids in school, and we've had recurrent problems in our county as well as other counties of quarantining teachers because they have contact with a case in a classroom or otherwise. Unfortunately, the schools don't have enough staff to keep the classes open when their teachers are being quarantined. If we can get teachers immunized, then we would expect that we'll reach a point where they don't have to be quarantined, classes can continue. It makes it easier to keep students in class, makes it easier for parents, especially of our elementary children, to keep working. So those are just some of the considerations.
So if you've been vaccinated, can you still transfer COVID to someone else?
Yeah, key question. There is no official guidance on that yet, other than if you've been vaccinated, you still have to continue all the same precautions, wearing a mask, social distancing, and so forth. It stands to reason to expect that if you've been vaccinated, you're less likely to carry the virus. But let me emphasize that the trials were set up with these vaccines to reduce illness. That means infection with symptoms. They were not set up to prove the elimination of asymptomatic carriage of the virus or asymptomatic infections. Now, the Moderna trial, kind of as a side note, did do some testing of individuals between doses and did show in a subset of patients that if you had the vaccine, you were less likely to have asymptomatic carriage of the virus, which makes sense. But we don't have the data yet at the national level to say that you do not need to forego precautions just because you got the vaccine. I'm hopeful and expectant that in the next couple of months that kind of information and guidelines comes out. Right now, though, that's still an unclarified issue.
Even with the vaccine available and being rolled out, it's important that they don't let their guard down, correct?
Exactly. Both because, you don't know who next to you may or may not have a vaccine, for example. Right now, we're in a high state of disease prevalence in our communities, and the vaccine process is just getting started. It's a gradual impact over time. We don't have to reach the full 80% for vaccination success to have some impact on transmission in our communities. But in our county, I estimate that so far we've only vaccinated about 7% of the people. And so that's not enough to probably make much of a dent yet in transmission. Yes, we all need to maintain all the same measures, even those of us who've been vaccinated.
So wear your mask, wash your hands, limit gatherings, and time you spend outside of the house. So all good advice. What's the latest on the COVID-19 cases in Routt County?
Yes, sadly, we're in another big wave, surge, whatever word you want to choose to use. This was expected last fall. It's been expected from Christmas and winter. And one of the challenges is we never got down from our last kind of wave, if you will, here right before Christmas. So we started at a higher level. And then, as expected, gatherings and, just all the things that happen over the holidays, Christmas Eve, Christmas Day, New Year's, have all no doubt contributed to a rapid kind of exponentially growing case count. In fact, last week, our number of new cases and the rate of change was perhaps the worst we've seen so far in this pandemic. We expect that over the next couple of weeks, we will likely surpass our previous high of weekly cases over 2-week case counts. We've managed so far, we'll continue to manage, and hopefully people's activities in our community will work to reverse this, but it is concerning to see us doing this. I've qualified this kind of a phrase I say is we're in our last worst months. January and perhaps February, are going to be tough months again. After that, I do think we'll be on the downward trend. It's just we got to get there.
And this spike in cases, this is due to the Christmas holiday, New Year's. Is that the case?
Yes. I mean, time-wise, it makes absolute sense. We know from our case contact tracing that many of these cases are connected to infections over the holidays. So a lot of cases being transmitted within family gatherings, social gatherings. We obviously see cases associated with various businesses. That's not to blame any particular business, just that's the reality. There's a lot of disease around, and indoor places where you gather with other people outside your home, maybe situations where you don't have a mask on, situations where you're putting food and things in your mouth, stuff like that. They're all potential opportunities to acquire the infection.
The benefit of the vaccine is to save lives, reduce transmission of the disease, and protect our community. With the vaccine being rolled out, when do you think we'll really start to see the benefit in the community of this vaccine?
I think by March we're going to really tell the difference. I think a lot of things will be at play there. I would hope by then that maybe a third of our population has been vaccinated by then. We will be out of kind of what I hope is the worst of the winter cold and flu season. And by that, I mean, there's just factors involved with us being inside in the colder weather, humidity in the air, all those things that we know traditionally play into the transmissibility of viral infections. So to get out of that, the vaccine's playing in. I'm hopeful that March and certainly April, we'll be looking at the worst of this in the rearview mirror.
That's good to hear. We have some relief in sight. It's going to take some time and hard work on everyone's part, but we will get there. Anything else you wanted to add today?
Just stick with it, folks. We're close now. I mean, I don't think it's a mirage to say that we see some light at the end of the horizon. I'm done with this. I think we're all done with this, but we've still got some effort and time ahead to get through perhaps even some of our worst weeks of it. So let's keep at it and keep hope and keep working with everybody in the community to try to help in all aspects. This is a challenge health-wise. It's a challenge with the economic impact on people. It's a challenge, mental health and school, all these things. So in every facet, we have to continue doing our best to get us all through together.
Well, thank you so much, Dr. Harrington. Great advice today. And we are so excited that vaccine is being rolled out in Routt County. So we'll continue to follow that and check in with you for updates. Thanks.
You're welcome.